Can families override an incompetent patient's wishes? Imagine a loved one in the hospital, unable to speak for themselves, and family members disagreeing about what's best. Who gets to decide what happens next? In medical ethics, patient autonomy means patients have the right to make their own healthcare choices. But when someone is deemed legally incapable of making decisions, things get complicated. Competency is about understanding and evaluating treatment options, and legal incapacity is a formal status decided by a court. Until a court says someone is legally incapacitated, their previous wishes must be respected. Many patients prepare advance directives or living wills to tell doctors and family what they want if they become unable to speak for themselves. These documents are meant to guide decisions and protect the patient's preferences. However, conflicts can happen if family members or healthcare providers think following the advance directive isn't right for the current situation. In such cases, the ethical focus is on whether the wishes were clear, relevant, and based on the patient's core values. When a patient cannot make decisions and has no advance directive or legally appointed surrogate, family members are often asked to step in. They act as surrogates, making decisions based on what the patient would have wanted, a process called substituted judgment. If the family doesn't know the patient's wishes, decisions are made based on what's best for the patient's health and well-being. Can families override the patient's wishes? Generally, no. If the patient is legally incapacitated and a surrogate is appointed, that surrogate must follow the patient's known wishes or act in their best interest. Family members cannot simply override these decisions. If there's disagreement among family members or with healthcare providers, hospitals often turn to ethics committees or courts for help. Courts review whether surrogates are honoring the patient's wishes or acting in their best interests. In practice, healthcare providers aim to respect patient autonomy by honoring advance directives and involving families when capacity is lost. If the patient's wishes are unclear or disputed, everyone works together to interpret what the patient would have wanted. Ethics committees help resolve conflicts and ensure decisions align with ethical principles. When disputes can't be settled otherwise, legal guardianship may be established. So, the answer is no. Families cannot simply override an incompetent patient's wishes. Surrogate decision-makers are bound to follow the patient's prior expressed preferences or, if unknown, their best interests. Disagreements are handled through ethical review and legal processes to protect the patient's rights and uphold the core principle of respecting patient autonomy, even when the patient can no longer speak for themselves.